The PKD Foundation is monitoring the unprecedented COVID-19 pandemic, and we want to keep the PKD community informed. My name is Nicole Haar, and I'm the Director of Community Engagement at the PKD Foundation. The PKD Foundation does not offer medical advice, and the information shared during this webinar is not intended to be a substitute for consultations with your healthcare professionals. Care and treatment decisions related to your health must be made in consultation with your healthcare team. Joining me is Chad Stevenson, and he will be addressing concerns submitted by the PKD community about dialysis. Chad Stevenson is a registered nurse and certified nephrology nurse. He has over 17 years of experience working in hemodialysis. Chad began his career as a hemodialysis technician at a dialysis clinic in Columbus, Ohio. Upon moving to Massachusetts, Chad transitioned to working for Dialysis Clinic Incorporated, the largest nonprofit dialysis company in the United States, where he now runs their outpatient dialysis clinic at Tufts Medical Center. Chad obtained his Bachelor of Science in Nursing from the University of Massachusetts, Boston. Chad, I'm going to turn this over to you.
Thank you, Nicole. I have no disclosures. Some objectives for today that I would like to review with the community is: what is COVID-19? What can I expect to change at my dialysis center, whether it is in-center or at home? Is it safe to skip a dialysis session in order to reduce exposure? What can I do to prevent an exposure? And how will I know if I have COVID-19, and if so, what happens next? You can advance the slide, please. What is COVID-19? COVID-19 is the new novel coronavirus from 2019. It's a disease caused by a type of coronavirus, primarily attacking the respiratory system. Can you advance slide? What can I expect to change at my dialysis center? If you receive your treatments in center, some of the things you will see change is that upon arrival at the dialysis clinic, you will be asked a series of questions. These questions will focus on shortness of breath, if you've had new onset cough, sore throat, direct interaction with a COVID-19 positive person. Some of the assessments that you will initially receive there in the lobby will be your temperature and your oxygen levels. And these help determine some of the classic signs of COVID-19 disease, being a fever over 100.4, new onset cough, or a sore throat. If you're a home patient, these will be likely assessed by telehealth or in your dialysis facility once a month. Can you advance the slide, please? Is it safe to skip a dialysis session in order to reduce exposure? It is not recommended to skip a dialysis session in order to reduce your exposure to COVID-19. First of all, clinics are taking extra precautions. These include enhanced disinfection practices, grouping of positive and presumptive patients, and providing masks to all patients and all staff. Second, going to your scheduled dialysis facility for your usual sessions ensures that toxins and fluids are removed. This helps improve your overall health, which reduces the likelihood that you would need to be hospitalized, further reducing your risk of exposure. Finally, maintaining your regular appointments ensures that trained healthcare providers will be continuously monitoring all of your signs and symptoms if you have any. Can you advance the slide, please? So what can you do to prevent exposure? The number one thing you can do is washing your hands. Recommendation is 5 mL of soap. What is that? 5 mL of soap is generally 2 pumps from a soap dispenser from any standard dispenser that you would see in the clinic. Once you've done this, wash your hands for a minimum of 20 seconds. Sing happy birthday to yourself or any other novel song you can think of that's at least 20 seconds long. If using a hand sanitizer, remember to read the label that is at least 60% alcohol in order to kill coronavirus. Avoid touching your face. This is another way that the pathogen can get into your mucosa. We do not realize how much that we touch surfaces and then continue to touch our face. So that's a number one thing also that you can be cognizant of. Wear a mask when going out in public and when you're going to be in close quarters with one another. Also maintaining 6 feet and being cognizant of those social distancing guidelines. An interesting one here I wanted to post because not a lot of people know this. Reading the labels on your disinfectant products at home. As you'll see to the right, I have just a label of a Lysol wipes that are just picked up at any Walgreens, Walmart. You'll want to see what they're calling either the wet or the kill time for coronavirus. And on here, you can read that on a non-porous surface, after you've cleaned with one of these Lysol wipes, it needs to be wet for at least 2 minutes to completely kill the coronavirus. That way, you want to have it wet for completely 2 minutes and let that air dry. Don't dry it with another towel or anything. You can advance the next slide. How will I know if I have COVID-19 and what happens next? At this time, only a nasal swab can show if a person has COVID-19. I'm realizing this slide is a little late. As of this week, we're actually using oral swabs as well. So it can be a combination. They might do a nasal swab or the swab in your throat. Remember, just because you do have symptoms does not mean you have COVID-19. We do want you to remain calm and not to be too anxious about the disease, and to just maintain your social distancing and isolate until your test is back. If you do have symptoms, you should always call your clinic ahead of time. Upon arrival at the dialysis clinic, a healthcare provider will meet you at the clinic's entrance, assess your signs and symptoms, and then depending on that assessment, you may be placed in a more private area in the clinic for your dialysis treatment. At that location, if the clinic does have testing kits, you would be swabbed, and then your test would come back in the next 1 to 7 days, depending on your geographic region in the country. Here in Boston, where I'm at, we're getting a 8-hour turnaround time, so it's been pretty convenient this past couple of weeks to have that increased testing ability. While you do wait for your test results to come back, you should self-quarantine between your dialysis treatments. Please do not stop coming to your dialysis treatments. Talk to your family and friends about how you can safely self-quarantine. This is a good time to make sure that your family knows the contact number to the dialysis facility and that we have all the contacts for your family members. And as I just mentioned, very important, make sure your clinic has all your medical contacts, anyone that you live with, and your closest loved ones. You can advance the slide, please. In summary, we want you to go to all of your dialysis sessions, monitor for signs and symptoms, call ahead to your clinic if you have any of these signs and symptoms so that you can be appropriately triaged. And for more information, you can visit the hyperlink at https://pkdcure.org coronavirus, and stay healthy. Go to your dialysis sessions. Thank you.
Thank you, Chad. At this time, we'll transition to some questions that have been submitted to the PKD Foundation by patients and families, specifically about dialysis. The first one I have for you, and you've already mentioned some of this, but maybe just a little review would be nice because it is a concern. What procedures have been put into place to protect dialysis patients from being exposed to COVID-19 while having in-center dialysis treatments?
Many of the multiple things we've done here at the clinic, removing the chairs to ensure that they are 6 feet apart, both in the lobby and in the dialysis center. We are cohorting patients, and by that means we assess patients if they become what we would consider a person under investigation, meaning they've had a sign or symptom of sore throat, cough, fever, that we would isolate them into a certain private area of the clinic for further triage. Once all these patients are established, then we're able to have one section of our room that would have possible patients under investigation, and then those that have no clear signs or symptoms, to put that further barrier in between the two patients. Other things that we're doing, all staff are wearing masks and all patients are wearing masks. Increasing the amount of hand sanitizers in the clinic and the disinfection processes at the end of the night. Those are some of the biggest things that we're doing right now.
Thank you. That makes a lot of sense, and I'm sure that's going to help anyone that is worried about those things to feel a little bit better. And And then are access surgeries for dialysis considered essential procedures?
Yes, and some of these are on a case-by-case basis depending on your geographic region and your hospital, but dialysis access procedures are still considered essential. We do see some patients having catheters put in place first if there wasn't time to put in a fistula or a graft or PD catheter in advance, but there is no holdup on getting your dialysis started if you need to have dialysis. We are here for you.
Okay, thank you for that. And the last question that I have for you, are you seeing more patients needing dialysis that have not had procedures for dialysis access?
Generally, most patients that we see, at least here at inner city, a lot of new patients are coming in, they receive catheters first, and then they're going on dialysis. And, in the perfect world, we would have met this patient a few months earlier, got them through some of our clinics, had a vascular surgeon see them, and then get those procedures on the way. But we do also get those patients into those vascular procedures after they've had the catheter and they're stabilized on dialysis, so that we can get the fistula and the graft or PD catheter placed relatively soon. That way that we are decreasing the overall chance of that person getting an infection with that catheter. So that overall decreases the infection rate both in the outpatient clinic and in the hospital, to make sure that you're not getting hospitalized.
Okay, thank you. Well, Chad, I want to thank you for helping us understand more about minimizing risk during in-center dialysis treatments, and for providing information that will help everyone determine questions that they need to be asking their healthcare team. The PKD Foundation appreciates the opportunity to provide you with the best education possible. Please take a moment and complete the brief survey included with this recording. We appreciate your feedback, and your responses will be used to develop additional resources and programs in the future. When you complete the survey, please include additional topics that you would like for us to address in future webinars. If you have questions you'd like to directly ask the PKD Foundation, please email us at pkdconnect@pkdcure.org, and a member of the PKD Connect team will get back to you. On behalf of everyone at the PKD Foundation, thank you for watching this recording.